welcome to The Art of Being Human. I'm starting a section on drugs and what drugs do to us. And I want to start off by talking about pain medications and over-the-counter drugs because they affect us too. But we have to remember that everything we put in our systems does something to our systems. Everything we take into our body has to respond to, whether it be eating a vegetable or putting in an aspirin or taking a prescription drug or even an over-the-counter drug or a hard drug. It doesn't make any difference. Our bodies are going to respond to it in some kind of way, sometimes a good way and sometimes a bad way. So what I want to do first is start off with over-the-counter painkillers, and then we'll go on from there. And what I'll go on to will be marijuana, because that seems to be the drug that people are arguing about in terms of whether it should be passed for recreational use or for medical use only. So anyway, I do want to get into marijuana and the other drugs, heroin, cocaine, the harder drugs, and what it does to our systems, because we definitely have a very serious drug problem in this country. So first, let me just start off with pain medication. And I'm going to talk about the medication, what it does, and the risk of it. And I'm going to use these charts to do it. So I'm going to start off with acetaminophen. Now, acetaminophen, millions of people take it. It would include drugs such as Tylenol, Excedrin, Percocet, and Sudafed. What is the risk of these? We take these every day. A lot of people take them. Well, the risk is liver damage. If you take too much of something like acetaminophen, you may not realize it, but too much is very serious. You can get into liver failure. So any kind of substance like that, if you're taking medications for pain, and I'm not saying don't do it because they can be very helpful, but make sure you don't do it too much. Make sure you can only do it at the rate that the prescription bottle or the information on the packaging says you can do. I know I was working with a woman who was having a lot of pain, and she kept asking me, can I take this pill? Can I take that pill? And she was talking about acetaminophen, and I said, well, what does the packaging say? If it says 2 every 6 hours, then you're allowed to take 2 every 6 hours. If you decide to take 4 every 6 hours, you're overdosing, technically, and you could run into a more serious problem than the medical problem that you have. So when you take these drugs, be very careful that you follow either the doctor's instructions or the pharmacist's instruction or what's written on the packaging. Liver damage is a very real danger if you're taking acetaminophen. Now, what about the NSAIDs? NSAIDs, N-S-A-I-D-S, stands for non-steroidal anti-inflammatory drugs. That's what it stands for. You would include in here aspirin, ibuprofen, COX-2 inhibitors, and Celebrex. The risk of taking those drugs, you have an increased risk of heart attack and increased risk of stroke. I know my doctor won't let me take some of these medications, even though they're effective painkillers, because there is a stroke risk. And I notice some advertisements will say this is the safest of the drugs that could cause stroke risk, but that doesn't say much, does it? It makes people feel safe if they're taking it, but if there's a stroke risk and you've had a stroke, then there's a stroke risk and you need to be very careful. Then you have the narcotics, hydrocodone, methadone, oxycodone. And the risk is that you can have bone breaks, you can become dependent on them, you can have heart attacks. So there's no such thing as a drug that is so safe that there's no side effects. Now, corticosteroids would be the cortisone injection, and the risk is going to be pain and whitening of the skin in the injection site. Now, that may not be a risk in terms of your health, in terms of you're going to die of a stroke or something, but there is a risk no matter what you take. Now, I've got listed over here magnets. Some people feel that you can get healthy by wearing magnets or having magnets on you. because they somehow slow down some of the effects of the neurons firing. However, most magnets are too small, too weak in order to be able to do any good. Some people take copper because it's supposed to neutralize free radicals, but you know, you can't absorb enough copper to be effective. I know I heard a story, and I'm just going to tell this. I can't tell you whether it's true or not, but this is what somebody told me. She took copper because it was good against strokes and TIAs. And she was an elderly woman, and she came to me one evening, and she said, I used to have TIAs every day. And it's frightened me because I knew they were TIAs. And then what happened was I searched the internet, and I came upon a story about a turkey farm in California. And in that turkey farm, the turkeys were just dropping dead of heart attacks and strokes, as it turned out. And so therefore, what they did was change the nutrition of these animals so they wouldn't get sick. And they put extra copper in their diet. And lo and behold, they didn't die of stroke or anything. They maintained, healthy living. So she said, I tried it and it worked for me. I took 2 milligrams of copper every day or every other day. And I said, well, how would you know if you got too much copper? And she said, well, she says, if you're unsure about it, you can take it every other day instead of every day. And she says, it stopped my TIAs. I haven't had one since. And so what she did for herself, and I'm not saying that it's healthy or not healthy. I'm not making a judgment. I'm not telling anyone to do it as an experiment. But according to her, if you take the copper, or if she took the copper every day or every other day, she had no more TIAs. With that, she went out of the building. It was in a church service, and I never saw her again. I expected to see her again, but I never saw her again. And I talked to people, and they said they never knew her. They didn't know who she was. They never saw her. And I described what she looked like, what she was wearing. She had a cane. She had a little difficulty in walking. She was elderly. No one ever knew who she was. And she just kind of appeared, walked over to me, talked to me about this, and walked out of the building, and that was the end of it. So I'm relating the story to you, but because it was her experience in terms of taking copper to help prevent strokes. And as I say, I'm not advocating it necessarily. I'm not saying that it's healthy to do or it's not healthy to do. I'm not suggesting that you do anything like this, but it was her experience and with this kind of supplement, and it was helpful to her. So I thought I would just relate that to you. It's a story about the copper. Okay, some people use hypnosis for temporary relief, and according to what I've read, hypnosis is about 20% effective against symptoms. If you're having symptoms, you're uncomfortable, you're in pain, some people use that. Some people use acupuncture, and it helps them. There are lots of alternative therapies, and I'm not an expert in alternative therapy, so I'm not making any recommendations, just bringing it to your attention, and then you can do as you choose. Well, I want to start talking about marijuana because marijuana is a very popular drug, and a lot of people use it, and they want to feel good from it. I don't know how safe it is. I have questions about its safety. Nonetheless, we are having an argument in this state and a lot of other states where marijuana is being legalized. For some states, it's just for medical use. For other states, it's for recreational use. How much is safe? Should you take it at all? I've got my questions about it. So my saying is, if you're going to take anything, you should know what it can do to you. You should know what the side effects can be. You need to judge, make a sound judgment. Anyway, marijuana, it comes from the cannabis sativa plant, and the main ingredient is called THC for short, for tetrahydrocannabinol. That's the name of the drug, but it's shortened to THC. And marijuana is the most common drug used next to alcohol. and it's made with dried leaves, stems, and flowers of the plant. There is a drug called hashish. Hashish is just a more potent form of the drug, and it comes from the resin of the flowering tops of the plants. The drug is usually smoked, sometimes eaten. This is marijuana. This is the effects of marijuana on your system. It depresses the brain. It makes the brain work slower. It lowers inhibition. It can cause dependence, emotional dependence. Now, I'm not talking about physical dependence. There is a difference between emotional and physical dependence on a drug. An emotional dependence, you want it. You want it. You crave it. In a physical dependence, if you don't have it, your body's going to react in a bad way because your body is demanding it. And of course, that leads to sometimes really severe withdrawal symptoms. But with an emotional dependence, you can actually crave it to the point where you're not going to be happy unless you have it. Have you ever been in a situation where you're working and suddenly you're really craving orange juice or something? You just want something, and you know what it is that you want, and you're not going to be happy until you get it. You'll even run to the store to buy orange juice if you don't have it, because that's what you want. That's what you're craving. And with the emotional dependence, you can get a very, very strong emotional craving for something, and that's what you want. Well, you stop to think of pregnant women, and they crave certain foods. And it's kind of a joke. They send their husbands out after pickles or something because that's what they want, and they won't be happy with a substitute. They have to have that which they're craving. And so when you get into drug use, people will crave the particular drug that they want. In this case, it's an emotional craving more than the physical one. Nonetheless, it is a dependency. It can cause tolerance, and what that means is that once you get a certain amount in your system, you tolerate it, and then in order to get the same effects of the drug, you have to have more of it. Supposing you take a few ounces and you feel really, really good. Well, later on, you can take those same few ounces after a few days and you don't feel really, really good. You have to have more and more to achieve the same kinds of feelings that you had when you first took the drug. Now, in alcoholism, and I'm going to get into alcoholism later, but something similar is true. In alcoholism, you can drink and then you stop drinking, and you may feel, that you're not in quite control. You have that buzz or whatever it is. I don't know. I don't drink. But after a while, that goes away, and then you feel just like you did before. And you say, well, this is safe. I can drink a little. I can get high on it. And then it goes away. The effect goes away. And then I'm back to where I was before. So therefore, it's safe to drink alcohol. But the problem is, after a while, it's going to take more alcohol to achieve that effect, and more and more and more, because you get to tolerate it. When you get to tolerate it, it doesn't have the same effect. And you have to have more and more to have the same effect. And that, of course, is a bad thing. My definition of alcoholism is when you stop wanting it and then you start needing it. When you start needing it and feel that you have to have it, it's not that you just want it, but you actually have to have it because it's a physical need. When it becomes a physical need, you have crossed the line into addiction. So you don't get addicted with marijuana in the same kind of way as you would with alcohol. Nonetheless, it is a gateway drug. You have to have more and more of it to achieve the same effects. And then after a while, if you get too much of it, if you get too much marijuana, even though it's not a hard drug like heroin, you can start having hallucinations. You can have the same effects as if you were taking a hard drug and were addicted to a hard drug, if you take enough of it. The key is the dosage here. Okay, so it causes tolerance, it causes dependence, and it can cause tachycardia. Tachycardia is a really, really fast heartbeat, and that's not a good thing to have, especially if you have heart problems. But it will give tachycardia. It will decrease the blood pressure, and it will give you a greater amount of tar in the lungs than regular cigarettes will. It will obstruct airways, so it makes it very hard to breathe, and it does contain carcinogens, cancer-causing agents. So let me just read over these quickly. It depresses the brain, it lowers inhibition, it causes dependence, it causes tolerance, it gives tachycardia, it decreases your blood pressure, you have a greater amount of tar in the lungs than you would with regular cigarettes, it obstructs the airways and makes it hard to breathe, and you get more coughing and so forth, and it contains carcinogens. Now, there will be abnormalities in addition to these in the sperm count, and the structure of the sperm is changed. Whether that leads to birth defects, I am not sure about that, but that's a known cause, a known effect. It causes failure to ovulate in the female, and it tends to give spontaneous abortions in females. People who take it feel high, but they also have impaired judgment. They don't judge time or distance right. There was a man who was driving, and he was under the effects of marijuana, and he said he felt himself like his car was 2 or 3 feet off the ground, and he was floating down the highway. Now, I don't know how much that impaired his judgment. I can't imagine it did it any good. But he was under the influence, and he just floated down the highway. That was his sensory. This was sensory experience. You'll talk to people who have marijuana, and time goes incredibly slow for them. It's like, they're laying down, let's say, and they look up, and they feel like 3 seconds have passed rather than the time that has passed, or they feel that they should have passed a lot more time than they did. It makes time run slow. Now, I remember the last heart procedure I had, they gave me a drug to help control pain. And I had a similar experience. I wasn't high on drugs. This was injected in a hospital setting for medical reasons. And it seemed like it took forever for time to go by. I would think that time should be going faster, and I'd look at a clock and only 5 minutes had passed. And I was in a situation where I had to lay flat on my back for over 6 hours, and that's incredibly painful because you want to move. Your body wants to move, but they would not allow my body to move because it was a heart issue. And so I laid there, and I could twist a little bit and turn a little bit, but I had a terrific backache. And the pain medication that they gave me was to control the backache I had from laying flat on my back after this heart procedure for so long a period of time. But part of the effect was the time just seemed like I would be forever. That 6 hours passed so slowly, it was awful. And then the backache came back, so it wasn't that good for the backache either. But this is what drugs do. They will change the way that you experience time and the way that you experience distance. There's also changes of memory and learning. A person can have tremors, and their muscles can get rigid. Now, some of these effects of marijuana come with increased dosages. If a person is taking a higher dose, then they're going to get more of these effects than if they're taking a lower dose. But my concern is teenagers. If you have, who's going to be using marijuana recreationally? Well, probably young adults, and I can't say for sure, but I expect teens would want to try it. And if they try it at high doses, they're going to damage a lot. They're going to damage maybe even their brains, because their brains are still developing, and this drug affects the brain. And it has been said that it does stop and interfere with the development of normal brain function in teenagers. I haven't read the research on it, but this is what is said. Now, toxic effects, if you take too much. I'm going to have to start watching my time here. Panic attacks and acute psychosis. Now, the acute psychosis is going to be a person starts hallucinating. They're going to start having delusions, and they're going to start hallucinating. That's going to be a toxic effect. Cannabis intoxication, if you get so much that you're really impaired, you will have impaired motor coordination, you will have euphoria and anxiety at the same time, a sensation of slowed time, impaired judgment, and impaired motor skills for approximately 8 to 12 hours after the drug has been taken, so that it does interfere with driving skills. Driving risks for marijuana use is going to be the brain works slower. It is not in tune with its surrounding. It's introverted. It dulls the senses, and it impairs the sense of reality. And that's the problem you're going to have if you're driving under the influence of marijuana. Now, the medical effects, it does relieve nausea and vomiting in chemotherapy, and so it has some use there. It does help chronic pain, it helps glaucoma patients, and it helps patients that have multiple sclerosis. Marijuana is not a narcotic, it's not a hallucinatory drug, but you can get hallucinations from it if you take too much of it. People do feel drunk sometimes when they're taking it, and they experience hallucinations if it's taken at a high dose. Now, what are the withdrawal symptoms? Irritability, restlessness, insomnia, they become anorexic, nausea. Those are the withdrawal symptoms if you have too much of it, and it is a gateway drug in the sense that it leads to the use of other drugs which you can be dependent on. In fact, if, I guess I have time to say this, if people try to get some of the medications, you know, oxycodone and the high-powered pain medications off the street, or if they try to get them off the internet, sometimes a drug dealer will mix a little heroin with it. And in the end, they're not addicted to the pain medication, but they are, in addition to that, addicted to heroin. And that's a terrible drug to get in and out of. It just is. So I'm going to close it here, and we're going to go in next time as to how people get addicted to begin with. What happens in the body that causes people to get addicted to drugs? And then after that, in future segments, I will be talking about other drugs. So we'll close it here. Please join me next time.